Hi, my name is Kaylee Batterham, and I am going to be assessing, demonstrating, and giving corrective strategies for an overhead squat with an asymmetrical weight shift. So what's happening here when you see a patient performing an asymmetrical weight shift is that when they do an overhead squat, which is normally supposed to look like both sides coming down at the same time, the patient will favor one side, and this might be due to a knee injury, a hip injury, or low back problems. They will squat by favoring one side, and their butt will point out in the opposite direction. So this is what it looks like in an anterior view. From a posterior view, you can see it a lot better where they're sticking their butt out to the side. So what's happening here is that there are some overactive muscles and some underactive muscles that need to be activated. So some of the overactive muscles that you see during an asymmetrical weight shift is the adductor complex of the favored side. When they come down, the adductor complex is overactive, and also the gluteus medius of the opposite side is overactive. And for underactive muscles, it's the exact opposite. The adductor complex of the unfavored side is underactive, and the gluteus medius of the favored side is overactive. So, what are some strategies that we can use to correct these compensations through inhibiting, lengthening, activating, and integrating these muscles? So starting off, we want to inhibit the overactive muscles. Now by inhibiting the overactive muscles, we're actually loosening them up. We're rehydrating those muscle adhesions or knots, and they're going to become looser and more easier to work with. So starting off, we want to foam roll. This is going to be our first step to inhibiting the muscles, and the muscle group that I want to focus on is the adductor complex of the favored side, because that is the overactive side. So what we're going to do here is that we are going to almost be on our hands and knees. You're going to have your foam roll vertical, and you're just going to put your leg out, kind of sit on it, and you're just going to roll back and forth. Now you're going to have to feel for any muscle tightness or any muscle knots, and if you feel one, you're going to sit on it for about 2 seconds and then keep on rolling. And you're going to want to do this for about 2 minutes, and you can do this daily. The more often you do it, the more loose or malleable that overactive muscle is going to be. Next, we're going to lengthen the overactive muscle. We've already inhibited the muscle, we've rehydrated those muscle adhesions, and now we have to stretch out that overactive muscle. So we just foam rolled our adductor complex, so now we're going to stretch out the adductor complex. So what we're going to do here is a side lunge or a lateral lunge. So you're just going to step out to the side, bend this knee, and squat down. Now you should feel a stretch through the inner thigh. Hold it for about 10 seconds or so, or even we can do some repetitions. Hold for about 2 seconds, and we can do a set of 15. All right, now that we've lengthened and stretched out our overactive muscles, we want to activate our underactive muscles. And so we're going to do an isolated strengthening exercises and a positional strengthening exercise. So the isolated strengthening exercise that I want to show is called a side lying gluteus medius series. So what you're going to do is you're going to lay on your side, preferably the side with the overactive adductor complex. You're going to lie on your side, bottom leg is going to be bent, that way it gives you a little bit more stabilization. And you're actually going to lay on your side to give yourself a neutral spine. You're going to roll the hips forward, that way you get a little bit more leverage. I'm going to lift the leg up and then right back down, doing a set of 10. And then we're going to actually do some leg swings. Again, there we go. We're going to go back and forth, doing some flexion and extension. And then lastly, we're going to do internal rotation and external rotation of the leg. We can do a set of 10 of each, and we would do this about 3 to 4 times a week, because if we're doing other exercises that is activating the gluteus medius, we want to set some days in between to allow for rest for muscle fatigue. And then next, we will do positional strengthening exercise. I unfortunately do not have a partner to help show this, but it would be the exact same of lying on your side, and a trainer, physical therapist, or professional would be usually above you, or holding on to the underactive leg, and they would actually push down on the leg while you push up, and you would do that for about 10 seconds, a couple of sets each. Lastly, we're going to integrate some dynamic movement into our strengthening exercises. And what we can do here is a box squat, a sit to stand, or a wall squat. Either of those exercises, so we're practicing the motion of squatting or sitting down for the patient who is having problems with that asymmetrical weight shift and favoring that one leg. So what I'm going to demonstrate is a sit to stand. So what we're going to do here is we're going to have the patient sit at the very edge of the box or chair that we're having them sit on, and usually it would be a lot higher than this, but for now, just for demonstration purposes, we will be using this short little stool. So we're just going to have them sit at the edge of the box. Feet are going to be shoulder width apart, knees right over their heels, and we're just going to have the patient stand straight up, and they're going to slowly come back down, pushing those hips back, trying to keep those knees in place and trying to keep them from tracking over those toes. And they're just going to slowly sit back down and sit. We don't want them going up and down rapid or just in fast motion, because we're really focusing on the slow motion of coming back down and not plopping down onto the chair. And if there's any difficulty or compensations with knee valgus, we can give them a band so that they can pull those knees out. And we would do this about 3 sets of 10, 3 to 4 times a week.